Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Presidential Task Force on COVID-19 shifts date of international flight resumption by 1 week, says new date September 5th, sacrosanct. Bayelsa State joins the League of States to get its own COVID-19 molecular diagnostic laboratory. Coronavirus test results now out between 6 to 8 hours. States in the South embark on more testing as Edo State tops with 100 deaths, the highest in the region. And at least 1/3 of the world's school children unable to access any remote learning in the months when COVID-19 shuttered schools. $221 COVID-19 cases in 19 states and the Federal Capital Territory. That's the number of coronavirus cases Nigeria recorded in 24 hours, the lowest in almost 12 weeks. According to the Nigeria Center for Disease Control, NCDC, the cases are reported in Plateau State with 60 cases, 33 in the STT, 26 in Kaduna, 18 in Rivers, 17 in Lagos, 9 in Enugu, 9 in Kwara, 9 in Ondo as well, 6 in Nasarawa, 5 in Gombe, 5 as well in Anambra, 4 each in Delta and Abia, 3 in Imo, while 2 in Edo, 2 in Ogun, another 2 in Oyo, as well as 2 in Osun, while 1 each in Bauchi and Kano states. The total number of active cases went down for a second day by 99 cases to 11,730 after 317 people recovered, bringing the total number of those discharged to 40,281. In 24 hours, we lost 3 people to the virus, putting the total since the outbreak to 1,010. Nigeria, with a total confirmed cases standing at 53,021, has an attack rate of 25.48 per 100,000 of its population. Now, it is the first Council of State meeting for the year 2020 since the outbreak of the coronavirus, and Nigeria recorded its first case in February, while the last meeting of the Council of State held in January 2019. President Muhammadu Buhari earlier today presided over the meeting at the council chambers of the State House in Abuja. It was a closed-door virtual meeting which had in attendance the former President, Goodluck Jonathan, physically present, while former heads of state, Ernest Shoneko, Abdulsalami Abubakar, and Ibrahim Babangida attended virtually. The Vice President, Senate President, the Attorney General of the Federation, Secretary to the Government of the Federation, the Minister of the FCT were all physically present as well at the meeting. While we also had the former Chief Justice of Nigeria, Mr. Walter Noge, also joined virtually alongside state governors across the country. The Council of State is supposed to meet quarterly to advise the executive on policies geared towards nation building. Now, the Presidential Task Force on COVID-19 today painted a narrative of how difficult it is to manage the coronavirus situation in Nigeria since the index case 6 months ago. The Secretary to the Government of the Federation and Chairman of the Task Force, Mr. Boss Mustafa, noted the devastating effects of the virus on the nation's economy, resulting to the slump of the GDP and its effect on the aviation sector. Mr. Mustafa says the PTF is committed to flattening the curve of the scourge and that, more importantly, the committee will continue to ensure transparency as it launches the Transparency Initiative dashboard on COVID-19 resources. Now, the PTF also shifted the date of international flight resumption to the 5th of September. That's by a week, a date it says is sacrosanct.
As we enter the last week of this extended eased lockdown phase, and not the impressively declining fatality ratio and reduction of confirmed cases, the Presidential Task Force would also like to draw our attention to a subtle change in the epicenter of the virus. As mentioned by the Lagos State Commissioner for Health and a notable COVID-19 warrior, Professor Akin Abayomi, Lagos has passed its peak, but we call for vigilance and cautious optimism because the scourge is not over yet. Recently, the National Bureau of Statistics released the second quarter 2020 performance of the economy. It showed that the gross domestic product GDP slumped to minus 6.10% due to the impact of COVID-19 on oil market and other variables. This underscores the impact of the pandemic on the global economy. As we have often repeated, the pandemic also presents us with opportunities and impetus for innovation, creativity, and industrial development. Today's briefing has been packaged to underscore the level of transparency with which the resources deployed for the fight against COVID-19 have been put to use. As part of this briefing, the PTF Transparency Initiative dashboards will be launched, and that explains the presence of our development partners here today. This is a significant milestone because it puts valuable information at the disposal of every Nigerian.
Now, as part of efforts by the Bayelsa State government to effectively tackle the COVID-19 pandemic challenge, the state's Molecular Laboratory Research and Diagnostic Center marks an end to the rigorous task of getting sample results from Edo State and also neighboring river states. Located within the Bayelsa State Medical University complex in Yenagoa, correspondent Dobra Timiwood brings us an update.
The COVID-19 test can now be done in Bayelsa State. Even though what has been worrisome amongst residents of Bayelsa State since the onset of the coronavirus in Bayelsa State is the fact that the state boasts of having a world-class diagnostic center that couldn't conduct a coronavirus test. But now, even though the state government has not replied why the diagnostic center has not been conducting tests, they have created a new facility that can now conduct tests for suspected cases of COVID-19. We spoke with the head of public health in the state, and here's what he said will be the impact of the facility in Bayelsa State.
Now, what it brings to Bayelsa State is that we'll be able to return results in a very short time. Before now, it used to take us close to even 3-4 days, sometimes even up to a week, to get back our sample test result. But with this laboratory in place, one of the best in the country, we can, in a period of 6 to 8 hours, know the status of a sample we've sent in and begin to give definitive treatment. We have one of the best PCR machines that could run about 200 tests a day. We have some of the best biosafety cabinets, the analyzers, the centrifuge, and all of them are very sensitive and very modern equipment we put in that place.
No new case was recorded today in Bayelsa State, and 5 persons have been discharged from the isolation center, making the number of active cases for COVID-19 26 in Bayelsa State. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Now, ahead of flight resumption, the Federal Airport Authority of Nigeria FAN held a simulation exercise at the Murtala Mohammed International Airport, Lagos. A chartered flight to Paris was used as a test for the COVID-19 protocols in place. The flight, which was the only flight today, arrived Nigeria earlier. Before now, the Minister of Aviation, Hadi Sirika, announced that the reopening of international flights will begin with Lagos and Abuja, as was done with the domestic flight resumption. Nigeria's airspace was shut to international travel March 23 as part of measures to contain the coronavirus outbreak.
We are departing about 102 passengers out of Lagos to Paris. Then incoming, we are receiving about 93 passengers. But income passengers to Nigeria are expected to have COVID-19 negative result. So that is mandatory. One is just using our flight to test run what the situation is going to be when international flight commences from the 29th of August.
Welcome to the program. We have joining us in the studio Ebitia Omolara, a fellow at the West African Postgraduate College of Pharmacists, Chief Pharmacist, National Orthopedic Hospital, Igbobi, Lagos. Thank you for joining us on the program.
Thank you for having me, Melissa.
All right. I want to begin today what happened, and that is the Africa region, WHO, talking about the gains and the success as, of course, Africa certified wild polio free. They talked about calling on the need for caution, saying that the lessons learned should also be adopted in the fight to COVID-19. I want to ask you what those lessons were.
Okay. Thank you. The news of our polio-free certification is great news, and let me congratulate the federal government and the people of Nigeria for that. And talking about the lessons learned from the wild polio, we see a situation where there was requisite political will, on the part of the government. There was active disease surveillance and containment. That is something that we can adopt in our fight against polio, against COVID-19. Also, it's important that we have widespread sensitization amongst the people. When we have the vaccine approved and it's available, it's something that there should be continuous education. We should let the people know the importance and the need for the vaccination. Very importantly, a lesson that we need to take, if you remember our polio story, there was a time that it looked as if we were going down the curve and everybody was happy, but at some point we had a spike. And that is one very important lesson that I would want us to take and apply to COVID-19. We should not let down our guards. If you look at the numbers today, it's, it looks as if our numbers are reducing, even though if you look at the statistics in some states, it's going up, but generally on the national level, it looks as if the number is going down. So we should not let down our guards yet. The international flights will be resuming soon, and so there is still need to continue with what we are doing.
We had the polio vaccine, which also helped in its fight, but we also know some of the resistance that came with that in some parts of, especially Nigeria. But can we eradicate COVID-19 without a vaccine?
It is acknowledged that the containment of infectious disease is very, you need vaccines and vaccinations. They are very important. So talking about our Nigerian case, with respect to polio, you saw, like you said, the resistance that came up to the vaccine and all of this. So we cannot, it's very important. It's almost impossible to say that we would eradicate COVID-19 without a vaccine. But needless to say that, trials are still ongoing with the vaccines. There are different candidates in different phases of trials. So the outcomes are not known yet. So what we need to do is to continue, like I said, with the things that we have been doing, and also to that continuous education so that what we had with wild polio does not happen with the case of COVID-19.
Finally, where is the Pharmaceutical Society in Nigeria? Where are they as to homegrown solutions and other research work?
Okay. Well, NAFDAC had said that there are about 40 thereabout herbal preparations that have applied to NAFDAC for certification and studies. And also, the Pharmaceutical Society is partnering with NAFDAC in these studies. Also, the DG NAFDAC made a statement on the trials with chloroquine. On the trials with chloroquine, and let me quote her to say that it's been discovered that chloroquine is working, but it's a study, like other drugs that are also being studied for the treatment of COVID-19. It's not conclusive yet, but the success so far with chloroquine in Nigeria, it's it's corroborated in other African countries like Ghana, Senegal, and the like. So that is where we are currently.
I'd like to thank you so much. Vaccine will be a vital tool in, seeing that it goes away. And this is inclusive of the non-pharmaceutical measures that we should take seriously. Thank you so much, Mrs. Ebiti Amalara, a pharmacist. Thank you for joining us on the program.
Thank you very much for having me.
We have more on the COVID-19 updates when we return. Please stay with us. Over to Kwara State, where the government has lifted a ban on non-contact sporting activities in the state, assuring of a gradual process to allow other sporting activities return soon. This is due to what was closed, and this is at the beginning of the coronavirus pandemic, especially when Kwara State recorded its case. The state governor, Abdulrahman Abdulrazak, announced this while he was playing host to the president of the Nigerian Football Association, noting that one of the challenges being faced today is the lack of standard pitches, urging state governments to intensify efforts in this regard. So the Presidential Task Force on COVID-19 today still drew attention to the behavioral changes that needed to continue. But also we will closely look at businesses and indeed if anything has really changed. Joining us from our Abuja studio is Dr. Hassan Sule. He's a public health academic, the Department of Public Health and head clinic at the National Open University. He joins us from our Abuja studios. Glad you could join us today. Thank you for joining us.
Yeah, thanks very much for having me.
All right, Dr. Hassan. Now, do you think that businesses are adopting the COVID-19 protocols, the COVID-19 measures? Because across the country, we've talked about how some markets are not adhering to the protocols, how some people are still lax in indeed wearing the face mask and some of the other measures. But for businesses, do you think that this is working, this is happening at those points?
Oh, thanks once again. In my opinion, I'd say there seems to be a general relaxing of attitudes towards prevention of COVID-19. And so yes, certain businesses like supermarkets where a lot of people go to and malls, they tend to keep up with the protocols, but other places like public offices, a few of them who have opened up, there isn't all that strict adherence, you'd say. So we have a situation where we may be letting down our guards too quickly. And the worry for that is that vulnerable people within our populations could come in contact with the virus, and then we may have a second line of transmission or a second spike. But generally, the statistics are reassuring, however. There's a lot of testing going on, but not many positive cases coming in. Today, I think we have around 221 cases. I'm not sure the number of testing that was done, but I know the testing capacity has gone up.
Situation somewhere where an indoor airborne event, according to that report, a meat plant worker transmitted the virus 24 feet away. And they're saying that this is perhaps 4 times farther than the current 6 feet, which we're meant to maintain. But this was indoors, and the talk was really more about it was an air-conditioned area, it was a confined area, so there were no proper ventilation, filtration, or even the wearing of masks. So some people are saying maybe in such spaces where we have a lot of businesses operating, there should be a longer distance in terms of physical distancing farther than the 6 feet that is the WHO standard.
Yes, you're absolutely correct. In an enclosed space, the virus has greater chance of spreading. But then again, it brings to fore another challenge that we have, that, okay, an enclosed meat factory which needs to be enclosed and air-conditioned. How do you put that in? How do you marry that together with the fact that keeping the place open and open to air and natural light? how do you put that together in the light of the meat that they sell, which need to be refrigerated or kept cold? So it's true, in an enclosed place, the chances for the virus to spread through air conditioning, which also is a sort of propellant for the virus because the virus is buoyed up in air, the chances are high. So, like you rightly said, there need to be a modification of that workspace, those kind of workspaces, more distancing, probably more testing for people who work in there, regular testing so that nobody slips through the cracks, brings the virus in and spreads it to people who work there. So you're absolutely right. That kind of working environment poses a huge risk.
All right.
It's fertile ground for the virus to transmit.
And perhaps more ventilation and wearing of masks while working. Thank you so much, Dr.
Yes.
Hassan Sule, a public health academic
Yeah.
at the Department of Public Health, head of clinic at the National Open University. Thank you for joining us on the program.
My pleasure.
Now, with all the talk of returning children safely to school, startling statistics from the United Nations Children's Agency indicates just how important getting back to the classroom would be. At least 1/3 of the world's school children, some 463 million, were unable to access any remote learning in the months when their schools were closed due to the coronavirus. Here's more on the global update.
French Prime Minister Jacques Castex is warning of an undeniable surge in cases in the country. Apparently, the number of departments in France where the virus is in active circulation has climbed up from 2 to 21. Masks are also going to become compulsory everywhere in the capital, Paris. But France is far from being the only country on the continent seeing a rise in the number of infections. Other European countries are also battling a spike in number of cases. Spain's regional leaders are trying to coordinate the return to school with health and education officials as infections and hospitalizations continue to rise. During a news conference, authorities announced measures for the opening of the 2020 to 2021 school year in September, including that of children the age of 6 required to wear masks at schools.
Well, this is extra funding.
The UK has announced it will pay low-income residents to self-isolate if they have confirmed or suspect they have the coronavirus, as the government steps up measures to keep the virus under control.
Well, this is extra funding in addition to the other benefits that people get for people who have to self-isolate because either they've tested positive or they're a contact of somebody who's tested positive and have been therefore told by NHS Test and Trace that they need to self-isolate. And it's all about trying to stop the spread of this virus by making sure that people who've tested positive, they stay at home and don't infect others, and their contacts, who are obviously at high risk of having the virus, also do the same.
The new policy comes after opposition politicians called on the government to introduce the payments amid concerns that some people who could not afford to take time off work were avoiding complying with the health advice. Finally, India has reported another hike in new daily cases, 76,000 on Wednesday. Simultaneously, fatalities also crossed 60,000, which means the South Asian country has the 4th highest death toll in the world. India has confirmed more than 3 million cases so far, with the latest million taking just 15 days to reach. In comparison, the country took 21 days to confirm 2 million cases and 167 days to reach the first million.
You can take a look at our website, channeltv.com, as it has regular updates about the spread of COVID-19. You'll find the local stories there, especially the federal government shifting the resumption of international flights to September 5th. But internationally, we hear that masks compulsory across Paris as COVID-19 cases mount, and several other stories there at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.